Good afternoon.
Yes, good afternoon.
Hi, how are
I
you?
Very good. My name is Dr. Hamza Yusuf, and I'm going to be your guide to make your diagnosis. So, as you can see your patient, you can go ahead and ask all the questions you want so that we can arrive at your diagnosis and you plan the treatment.
Okay. Yaneli Santana, and I'm gonna be with you today. What brings you in today?
Wai sunanta Santana, wata na so ta tambaye ku akan me yake damun yarinki. Ya. To wai me ya samu yarinki? Ciwon ciki? Okay. Okay, she actually has been having this fever and associated abdominal pain for the past 2 days.
For the past days. Has it been like worse at night or in the morning, or has it just been consistent?
Okay, the fever actually is more in the evening hours. It's more in the evening hours, and it is intermittent. It comes and goes.
Comes and goes. Okay. Is there any other symptoms, or is it just that?
Um, okay, she also mentioned abdominal pain.
Is it in the upper or in the lower part of the abdomen?
Wai ciwon cikin a saman cikin ne ko a ƙasan cikin? Eh, gaba ɗaya? Sai na ce a ta saman cikin ne ko a ƙasan ciki ko kuma kawai cikin ne. Okay, actually the mother cannot really specify. She just tells her that she has this abdominal pain.
Okay, that's fine. Um, is has she been tired lately, or is it just like the same energy?
Wai kina ga kamar ba ta da ƙarfi a jikinta ne ko kuma dama haka take? Eh? Okay, yeah, she actually has this easy fatigue and lack of energy.
Okay. Um, has she had an appetite, or has it gone away?
Wai tana son cin abinci har yanzu ko kuma ya ragu? Okay, she has some loss of appetite.
Okay, is there any nausea or vomiting?
Wai akwai amai ko kuma ji kamar za ta yi amai? Hmm? Gudawa kenan? Okay, she actually doesn't have any nausea or vomiting or diarrhea. However, she complains that whenever she's passing, whenever she's urinating, she usually has some pain.
Okay. Is it fine if there was like a blood test done or no?
Yeah, we did some blood test that showed uh, two clusters of malaria parasites on the blood film. Then we also did a urinalysis that showed a pH of 5.0, but there was no protein, no nitrites in the urine. And the wider test we also did for typhoid fever is also negative.
I'm sorry, is there any way you could repeat the first thing? Like, the audio cut out.
Okay, the first thing was a blood test that showed two pluses of malaria parasite. Then we also did a wider test for typhoid fever, which was negative. And we also did a urinalysis that was essentially normal.
Okay, so for malaria, it has been positive, right?
Yeah.
Okay. Um, okay, I would say she could get prescribed um big doses of antibiotics for her stomach because I think it'll react in a positive
Okay.
way.
Okay, would you like to start by giving some anti-malaria drugs for her malaria?
Yeah.
Yeah, I think some ACT, maybe Quatern, can be a good choice. Okay, right?
Yes.
Yeah, good. So would you also, is there any other thing you'd like to prescribe for your patient?
I don't think so. No, that'll be it.
Okay, would you like to talk to your patient about preventive measures against to prevent further future occurrence of malaria?
Um, I would say try to avoid any type of mosquito or anything that could harm the baby.
Okay,
And
great.
yes,
Would you like her to put on some long sleeves
long,
and yeah, and also to sleep in insecticide treated nets and, and also use some insecticides or bug spray to eliminate the vectors, right?
yes, anything to prevent any skin contact with any bugs that could
Great,
keep disease coming.
great. Okay, so I'm going to translate what you just said to your patient now, okay? So
Okay.
wai tana tunanin malaria ne ke damunta, so za ta ɗan ba ta maganin malaria ko? And kuma tana sa dogayen kaya, tana kwana a mosquito nets, so that kar sauro su cije su sa ta su ba ta malaria ko? Yeah. So I have translated whatever you said to your patient, and they're so thankful that you're doing this. They're also so grateful for for your help in making their diagnosis and prescribing some drugs for the patient. Okay. So if there's any other thing you'd like to say, you're free, or else you can wave your patient goodbye and have a nice day.
Okay, well, thank you for giving me the opportunity to talk to you. That's it.
Wai ta gode sosai, za ku iya mata, yeah, so they saying thank you.